Hi, my name is Dr. Wellens and I'm here to discuss StimRouter with you. I utilize it in my office for peripheral nerve pain as well as tarsal tunnel and some entrapment neuromas that failed non-surgical or even surgical care. I see a lot of second and third opinions, and of course probably the most common situation that I see is when people come to my office and they were told that nothing can be done in order to help them with their chronic peripheral nerve pain. So what is the most common presentation for a patient who would need a StimRouter? Somebody who has severe nerve pain, whether it's diabetic or non-diabetic neuropathy. We definitely see a lot of non-diabetic neuropathy. It's on the rise. We also see it in certain type of entrapments like common peroneal nerve entrapments, posterior tibial nerve entrapments, deep peroneal nerve entrapments, and some neuromas that have failed non-surgical and surgical care. Usually it's somebody who failed oral medications such as gabapentin, Neurontin, Lyrica, Cymbalta. Again, I've seen some diabetics who are on 3,000 milligrams of gabapentin per day, and they literally cannot function because they're sedated. They cannot drive, they don't think straight, and they would like to try to get off those medications. And of course, a lot of them would have done the research for peripheral nerve stimulator instead of taking 3,000 milligrams of gabapentin per day. And this is an outpatient surgical procedure that is done under minimal sedation with monitored anesthesia care and some local anesthetic. And I usually prefer to communicate with the patient during the procedure to ensure that the peripheral nerve stimulator, the StimRouter, is placed in a correct position. Again, in my personal experience, probably 95% of my StimRouters I either place on the common peroneal nerve or the posterior tibial nerve. So if you have any chronic pain in the lower extremity and you're not somebody who wants to continue taking massive amounts of oral medications, or if you had tried traditional modalities that have failed in the past and you're living in chronic pain, I would definitely recommend the StimRouter as an alternative to opioid therapy. So if you have any questions or concerns, please do not hesitate to call us. Again, I am Dr. Wellens with Central Florida Foot and Ankle.